So immunotherapy now has become very fashionable. Everyone have been asking the same question, whether immunotherapy is the medicine which will lead to reduction in cancer, which can avoid the entire surgical treatment and radiation treatment. Unfortunately, right now the evidence does not point to us saying that immunotherapy can be completely used to treat the entire cancer. Right now, the indication of immunotherapy would be in the palliative setting, where none of the cancer treatment, the first line of cancer treatment has not worked. Only then we use immunotherapy. Now in trial settings, there have been certain trials which have been conducted elsewhere in the world. So using that as an extrapolation point, we can consider giving immunotherapy in the adjuvant setting, that is after surgery. We can consider it as adjuvant in very select patients, and in very select patient it can be considered as a neoadjuvant treatment as well. But again, mind you, the treatment is very individualized, and we cannot completely say that immunotherapy can be given to everyone.
Okay, this is a good question. But the aim of reconstruction is to not just do a surgery, take a tissue from one part of the body and put it to the another part. The aim of reconstruction is to provide a functional outcome, and seeing properly, having a good vision is one of the major aims of doing a good reconstructive surgery. So for reconstructing your floor of the orbit, where basically the eyeball sits, if it is not reconstructed properly, yes, then you can have problems like you can see double vision, or far vision will be affected. But if it is done properly, like what we do at Sri Shankara Cancer Hospital, we can either put a titanium mesh, we can take a piece of bone from your iliac crest, that is the pelvic bone, and we can do the needful. So there's nothing to worry about it. All the solutions are available for a functional and a good reconstruction.
No, that is not true. Actually, if the surgery duration of surgery is less, then the surgical risk becomes slightly less. Whereas
There's a processes way, and there is only esophageal speech. Esophageal speech is where there is no instrument required. Patient can speak the sound of burp, and the electrolarynx is kind of additional device that patient uses in the neck, and with the effect of machine, the patient can, with the use of button, he can speak. Other thing is processes, where we keep the processes between the windpipe and the stomach, and the patient can close the stoma and he can speak. So these are the three options available after the laryngectomy procedure.
So after the completion of surgery and adjuvant treatment, that is either the radiation or chemoradiation, the patient has to follow up every 3 months for the next 1 year. So after the initial 3 months, we will be doing the surveillance PET PET scan to see for the baseline assessment. So every 3 months we will be looking for the clinical examination and also for the neck node examination, where we will palpate and see for any node or any ulcer or white patches in the oral cavity or anywhere in the operated area. So after the completion of 1 year, the patient has to follow up for every 6 months for the coming years, which is later extended to 1 year.
For head and neck cancer, usually when the patient is presenting to us in the initial stages, that is the early stage of the cancer, the surgery will be a curative intent treatment, and that might be a single modality of treatment which the patient might require. But if the patient is presenting with an advanced disease, if the patient is presenting in 3rd stage or 4th stage, he might require adjuvant treatment along with surgery. That is either radiotherapy alone or radiotherapy along with chemotherapy.
The suture removal after surgery is not painful. Usually we follow the protocol of what department and head and neck protocol we follow. After the discharge of the patient, we used to call the patient in the OPD, and according to the extent of the surgery, we start removing first the alternate sutures, and according to that, after 2-3 days we call the patient again, and then we remove all the sutures. Generally the suture removal is not painful. We clean it nicely, and then suture removal is done